there's this feeling amongst doctors that that diabetes is sort of chronic and progressive, but at the same time we were saying that, we knew it wasn't true. It was complete fabrication, because if you lose weight, we also knew it was almost for sure that your diabetes would either disappear or get much better. So it was a reversible disease. We knew it. Like, we knew that even as we were saying it was chronic and progressive. So it was, one was obviously a lie. And it was basically a lie we told ourselves because we were doing so badly on getting people to lose weight. So we lied to ourselves to say that this is chronic and progressive, when really, if we were being truthful, we should have said that doctors are doing such a crappy job in getting people to lose weight that they're getting the diabetes and therefore getting the kidney disease. And that's very close to the truth. So that's where I became extremely interested in the question of weight loss and why we're doing such a poor job. And a lot of it, I think, stemmed from this sort of obsession with calories, which is, it sort of misses the mark because the body doesn't actually measure calories in any way. So if it doesn't measure it, it doesn't, detect it, it doesn't respond to it, then that's not the most important thing we should be focusing on. And that was sort of the focus of my first book, The Complete Guide, the Obesity Code, which is a science based book on sort of what causes weight gain and weight loss. And one of the natural, in the last chapter, I talk about intermittent fasting because that's actually a strategy that makes a lot of sense from a physiologic standpoint, because I sort of went back to the beginnings and said, this is what causes obesity. It's really a hormonal disease, and this is what we can do about it. And sort of the last chapter was about fasting. And then that's where I started to use it in a lot of my patients and saw a huge amount of success, like stuff that honestly just blew my mind, like people that I had been treating for sort of 15 years with type 2 diabetes. And we started fasting and we changed their diet and it just went away. Like, I had a guy who I had followed forever, and nice guy, always wanted to do whatever he could to get better, but I didn't have the right advice to give him. And then finally, when I changed that advice, we got him off, I think he was on like 120 units of insulin, which is a really massive dose, to like zero. Like, we took him off everything. His sugars were normal. So we actually made him non-diabetic, and he's been non-diabetic for about 6 years now, after 30 years of type 2 diabetes, including 15 under my own care, right? Or 10 under my own care. So kind of ridiculous. And that's where I became very interested in sort of promoting these ideas so that people won't have to get, bad medical advice, such as the same one I was giving for so many years, and be able to make themselves better. Because again, if you get rid of that type 2 diabetes, then you are not only at lower risk of kidney disease, but you're at lower risk of a huge amount of other problems like heart disease and strokes and amputations and blindness and cancer. So like really, really important stuff that nobody was talking about. I mean, when I started talking about fasting in sort of 2013, 2014, like people thought it was insane to skip a single meal. It's like, and I'm like, why? Why would why can't you miss a meal? And everybody had the consensus, like honestly, like 99.9% of medical professionals were like, no, you can't miss a single meal.